Okay, let's just get this out of the way now. I am using a spatula for my microphone handle, but my microphone is coming in the mail, so chill, guys. All right, guys, today we're going to talk about the coronavirus vaccine. I've been on the fence about getting it. I don't know if I should get it, if I should wait for herd immunity, if I should even get it at all. Don't know what to do. So I decided to do some research. And just so you guys know, I studied molecular biology and did research at Mayo Clinic on lung cells. So although I'm not a professional in the field, I do have a scientific basis for the decision that I made. So what research did I do? I listened to some talks by Paul Offit, who is the co-inventor of the rotavirus vaccine and who is outspoken in his field for viruses and infectious disease.
There doesn't appear to be any serious adverse side effect with these vaccines. I mean, think about that. Vaccines are our way out of this pandemic.
I also tuned in to Peter Attia, who is a longevity physician and who has interviewed countless vaccine specialists. And then I jumped into scientific papers from the CDC, the Lancet, FDA, Johns Hopkins. I even tuned into a pro versus anti-vax discussion on YouTube.
It's just a lot of political nonsense going on. They're not telling us what the vaccine is made out of.
I agree. I don't think it's a one-size-fits-all because, again, everyone's body is so different that what might work for you might kill me and vice versa.
Oh, I also argued about it for about 30 minutes with my friend who is completely against getting the vaccine at all costs. Before we get into my findings, I want to tell you how the COVID vaccine works in case you don't know. The COVID vaccine is an mRNA vaccine. And mRNA means, well, forget what it means. It's basically a piece of genetic material that turns into a protein inside of your body. So once this mRNA is injected into your arm, it creates a protein by which your immune cells attack it and recognize it for the future. You build antibodies towards it. When COVID enters your body, it has little spike proteins on it. Your body recognizes it and kills it so that it doesn't cause a crazy infection like it did to other people. FYI, the vaccine that you get is not a live coronavirus. It's just genetic material that encodes for a protein that's found on the surface of the viral cells. What are some of the pros and cons of getting the vaccine? Well, the pros are you get less severe symptoms if you do get COVID. You can also travel more easily. Overall, the effectiveness of the vaccine is reported in the range of 70 to 95%, and that's well above the average effectiveness of the flu vaccine. The cons of getting the vaccine, you can get an allergic reaction to the shot. We don't understand the long-term safety profile of the vaccine either. You can also have an immunological response to the vaccine. The safety profile of the vaccine was characterized by mild to moderate pain at the injection site, as well as fatigue and headache. So far, about 90 million people have gotten the vaccine, which is quite a lot. From what I've seen so far, this vaccine protects against variants.
I think we can get on top of this virus. I think vaccines are our way out of this. The variants do worry me. And so it's the variants that are on my mind. To make it simple, you know an important line has been crossed. If you start to see people who have been fully immunized with, say, 2 doses of the Moderna or Pfizer vaccine, that nonetheless are getting hospitalized with one of these variants, most prominently the South African or Brazilian variants. If that happens, that's a bad sign. That hasn't happened yet.
Okay, so what are my thoughts? Although I'm personally at low risk, there are other symptoms besides just the dry cough and the fever and the headache. You can also develop vasculitis, which is inflammation of your blood vessels. And I don't know about you, but I would rather take my chances with the vaccine than get vasculitis.
What scares me the most about this virus is that it can cause vasculitis. I mean, who would have predicted that? It can cause heart attacks, it can cause strokes, it can cause liver or kidney disease because it causes vasculitis. This is not a virus that just gets in, kills you, and gets out, or gets in, makes you sick, and gets out. There are longer-term effects with this virus, and it should be taken seriously.
I'm a hardcore skeptic when it comes to putting things in my body, but for this virus in particular, I'm all for the vaccine. The potential for long-term tissue damage in my lungs and blood vessels makes me think, yes, I want to get this vaccine. For those of you that are still highly skeptical, I suggest do your research. Be skeptical, because the last thing I want to do is put something into my body that could have potentially more cons than pros. That being said, if you like this video, share it with someone who's still skeptical or on the fence about the vaccine, and hit the subscribe button to help out a fellow YouTuber. Hope you enjoyed this video, and I'll see you on the next one.